All right, I think we're going to get started, Kathy. So, yeah. Okay, my name's Stephanie Swartz. I'm with AMA Insurance, and I'd really like to welcome you here to our educational event this evening on Medicare. Our speaker tonight is Kathy O'Brien, Director of Education and Partnerships with Chapter. Kathy has more than 12 years of experience as a Medicare advisor to individuals and employers alike. Before joining Chapter, Kathy personally educated, transitioned, and advocated for thousands of Medicare-eligible Americans. We are pleased to have her with us to share her expertise on this important subject. Before we begin, though, I have a few housekeeping items. All phone lines will be muted during the session. If you'd like to ask a question, please use the Q&A chat function that you see. You can type your question in. We'll answer the questions at the end of the session and also during. So if there is a question, I will stop Kathy and go ahead and let her know that you have a question and she can answer it. Kathy and team will follow up with you directly to get it answered if we aren't able to answer the question. Finally, your feedback is very important to us. So we'll be sending you a short survey in the next day or two to collect your feedback from tonight's session. So without further ado, go ahead and take it away, Kathy.
Gosh, thank you, Stephanie. Thanks for that nice introduction. Yes, I've been doing this Medicare thing for a while, and I love what I do. So I'm excited to bring Medicare information to you all. And I do really encourage you to simply ask questions as we go along. I find it so much easier for people to assimilate the answers if you get the question answered as in context. So with that, let's get moving. Let's talk about Medicare and what we're going to talk about today. And our agenda is, what is Medicare? I think it's truly important to discuss what Medicare covers. It's equally as important to discuss what Medicare does not cover. So the flip side of the coin. Also, we'll go into any difficult decision that you need to make or confusing, complex decision you need to make. I think it's easiest to break it down into bite-sized pieces. So we're going to talk about the 3 decision steps in this Medicare process, trying to make it very simple for everyone. So oftentimes when we talk about Medicare, this is sort of the visual that we get, the Medicare maze. And let's break that down into some simple answers about what is Medicare. Let's start from the top, and Medicare is referred to as original Medicare, or traditional Medicare is also another phrase that refers to Medicare Part A and Medicare Part B. You put both pieces together and you get original or traditional Medicare. So Medicare Part A is hospital insurance, otherwise technically known as inpatient coverage. And Medicare Part B, on the other side of the line, is your medical insurance. Most of you are physicians. You obviously know outpatient services are primary care, doctor visits, specialist visits, and so forth. But Medicare B also covers things like lab work, any kind of x-rays, MRIs, medical equipment, and it includes preventative services like your flu shots and certain disease screenings. I do want to break down one thing that's pertinent for our times right now is all of COVID services are covered under Medicare Part B. So let me jump back over to Medicare Part A because I did skip that and I want to make sure that I've clarified everything here. So Medicare Part A, inpatient coverage, is inpatient in a traditional hospital. It's also covering mental health services and mental health facilities. Skilled nursing facilities are included and some home health care. And I'm sure you're all very aware of the coding system, and I can do a quick review on that. So Part A is your hospital insurance, and it is inpatient coverage, anywhere from a traditional hospital to a mental health facility, skilled nursing facilities, home health care, as well as hospice. All of that is covered through Medicare Part A. Medicare Part B, again, it is any kind of doctor appointments, whether it's primary care or a specialist. You've got your labs, your x-rays, your CT scans, durable medical equipment, and then any preventative services are also covered under Medicare Part B. Now, when I say covered, I need to clarify that. Medicare Part A and Medicare Part B cover part of the cost of your services. So what we're here today is to make sure that you understand what financial responsibilities you have, as well as what benefits you receive through Medicare, and then how we can fill the gaps financially so that we can maximize your benefits at a very affordable rate. So when we're talking about original Medicare, I want to talk about how we pay for Medicare Part A and Part B. And if in fact you have worked for 10 years, or the government refers to it as 40 quarter hours, then typically Medicare Part A is fully prepaid through your Medicare taxes that you've paid throughout your career. However, Medicare Part B, you do have to pay a monthly premium. And that premium is, this year in 2021, it's $148.50 per month, but it is means tested. So we can send you, if anybody wants to see the chart that is based on the income chart that would determine how much your premium would be, we would be happy to forward that chart to you. Now, as I was saying, Medicare Part A and Part B only helps to pay your portion of, or helps to pay for the services you're receiving. So that's what Medicare is. Let's look at the flip side and what Medicare is not. Oftentimes you don't know the question to ask when you're trying to see what something is not. I think that's not something that comes to my mind to ask the flip side. So the most important things to understand is that original Medicare or traditional Medicare, Part A and Part B, yes, they do cover part of your services, and you're responsible for 20% of the cost of the services, but that 20% never ends. There is no financial out-of-pocket limit to Medicare health insurance. So on the type of health insurance that we are mostly on right now, whether it's an Affordable Care Act plan or a group health insurance plan, those types of health insurance plans have a maximum out-of-pocket expense financial number. And just to be clear, Medicare does not have it. It doesn't exist. So we're going to try to explain to you how to fill that gap, how to reduce that cost.
Hey, Kathy, we had a question from Dr. Ahmad. He asked where you could find the chart that you were referencing. You had referenced a chart?
Yes, I referred. Ari's going to send out the chart. It's called an income-related monthly adjustment amount. It's an IRMA chart, and it's right off of Medicare.gov, and it shows if your income is this, then your Medicare Part B premium will be that. It's a very simple chart to read, and we'll go ahead and forward that chart. Does that answer the question? Let me know if I need to explain more on that. Okay. So the other part of what Medicare does not cover, which is very important to understand and to know, is it does not cover anything that's categorized as long-term care. So in the Medicare system, Medicare Part A will cover any skilled nursing facility stay up to 100 continuous days. And on day 101, the label on the person's chart is changed from a skilled nursing patient to a long-term care patient, and Medicare won't pay a penny of long-term care.
Kathy, we have another question from Dr. Adam. I'm going to pronounce it the way that I think, Galucci. He said, I'm over 65, but still receive medical insurance through my employer. What sort of preparations and when should I make them when I plan to retire and switch to Medicare?
That's a very good question. So I encourage you, when you turn 65, whether you're going to retire or not, to go seek the advice of a professional advisor, whether it's the AMA insurance or myself. I'd be happy to help to compare what your group plan costs and what your benefits are as compared to what you're eligible for in the Medicare world. And at that point in time is the perfect time to decide whether you're ready to transition into Medicare or not. So knowledge is power. Be able to find out exactly what you're eligible for And at that point in time, you can make your decisions. If in fact you're still working, you can enroll in Medicare Part A and simply not have to pay a premium for Part A. Remember, there's no charge for that, but then have double coverage, if you will, for your inpatient health insurance. Does that make sense?
We do have another question from Dr. Raquel. Is income limited to only 1040 income, or does it include 1099 and other income?
It's whatever is your modified adjusted gross income on your income tax return. So all income is considered. So let's go ahead with your Medicare card. So here is your card. You may have already seen one of these, but it is often referred to as your red, white, and blue card. Your name appears as you have registered with the Social Security Department. So when you go to apply or enroll in Medicare, you want to make sure that you're using your name as the government has it in their system, in the Social Security system. Now, oftentimes, people are used to having their health insurance card be that plastic card. We're all used to kind of a credit card looking sort of thing. Just know that your Medicare card, it's a heavy stop paper, and yes, it's real. Don't throw it away. So earlier we talked about any big decision or a decision that has some complex components to it. The easiest way is to break that decision down into smaller bites. So this is where we believe that Medicare's 3 decision step process makes Medicare simple to understand. So we're going to talk about, number 1, when to sign up for traditional Medicare and how to do that, considering additional coverage to plug that financial black hole, that 20% that Medicare does not pay, and then exactly how do we come across the specific plan that's in your best interest. So first and foremost, step 1, when should you sign up for Medicare? Well, it's kind of a 2-prong answer. Let's go with the easiest part to start with. You have an initial enrollment period that is based on when you turn 65. So the month of your 65th birthday is the cornerstone, and then you have 3 months on either side of your 65th birthday month. So you've got a 7-month window. Starts 3 months prior to the 65th month or your 65th birthday month. It includes the month of your 65th birthday, and it includes 3 months following. Now, if in fact you are already on group coverage, which some of you may be, then you're in the driver's seat. This isn't critical. It is important to understand that this is your initial election period, and that if in fact you enroll in Medicare at this point in time, there are no penalties involved. If in fact you do not have health insurance and you do not sign up for Medicare within that 7-month window, then a person would start to incur penalties.
We have 2 more questions, Kathy. So I'll start with the first one from Dr. Matt. He says, where again would a working professional who is receiving health benefits from his place of employment sign up for Medicare? So we'll start with that question, and then there's one more after that.
Okay, so I think I understood your question. So if you are a working professional, you've got group coverage, then you do not have to sign up, and there is no threat of penalties whatsoever. It is a good idea, I believe, in your best interest, to look at what you're eligible for in the Medicare world and then compare it to what you're currently receiving through your employer. Knowledge is power. Then you'd be able to compare the 2 and see which one is in your best interest. Does that answer that question?
The next question from Dr. Hannah, and again, I apologize if I'm not pronouncing correctly, but doctor says I'm about to change from full-time to part-time with no benefits. Can I buy insurance from AMA, although I'm still working part-time? So for that question, I will message you on the side, and you can contact one of our agents.
And as long as you're 65 years old, then Medicare would be in the mix. Perfect.
Yes, and someone, again, Dr. Matt followed up and said, where should he sign up for the Medicare?
Absolutely. So you go to ssa.gov, socialsecurityadministration.gov, and you sign up through their website. That's the easiest way to do it right now, especially during COVID. All the Social Security offices are closed. And if you do it online, you also avoid being on hold forever on the Social Security line. So you can do it via on the computer. I'd be happy to send you kind of the cliff notes on how to enroll. Got about a 5-minute instruction on how to enroll in 5 minutes or less. So you do it at ssa.gov, and it should take you about 5 minutes. So if in fact you are working, here's where the special enrollment period comes into play. If you're currently working and you choose to stay on your group plan until you retire or until you decide to transition into Medicare, then you will fall under a rule called a special enrollment period, where you're not going to be penalized for not having enrolled at age 65, either in Part A and or Part B. You can delay both, but if you're going to stay on the group plan, it's probably in your best interest to enroll in Part A and simply have double coverage for hospital care, and then just simply delay for your Part B. And when you do delay for Part B, you enroll online again at ssa.gov. And again, I can send you a separate link because it's a different application. But you do have 8 months after losing your group coverage to enroll in Medicare. Now, I don't advise you to wait that 8 months, because then you are going to have a lapse in coverage if you've lost your group coverage and you've delayed enrolling in Medicare. So you want to make that a seamless transition. But technically speaking, you do have 8 months to enroll into the Medicare system. However, there's a little caveat right there, and the drug portion of Medicare, which when we talked about Medicare Part A and Part B, you didn't hear me say anything about prescriptions. Medicare Part D covers drugs, and we'll talk about specifically what that is in just a second. But as far as timing goes, once you've left group coverage, you only have 60 days to enroll in a drug plan. So there's a default, or there's a disconnect between the 8 months to enroll in Medicare, but only 60 days to enroll in Medicare Part D. So we would just simply advise you to make this a seamless transition from group coverage. Once that stops, the very next moment, literally from midnight to midnight, you want to make it an easy transition into Medicare coverage. So what's the next decision? We've now decided, or we've figured out how you sign up and when you sign up for Medicare. Now let's talk about the additional coverages. So why would people look for additional coverage? Well, we talked about the 20% of the cost of services that you are responsible for, and we want to mitigate that 20% as much as we can. So let's make that smaller. But also, traditional Medicare does not cover any kind of prescription coverage unless you're signed up for a Part D plan, prescription plan. It doesn't cover any kind of dental coverage, no vision, no hearing. And those are kind of common things that people who are entering into the Medicare world are looking for services. Many times we can get those types of services included in a Medicare type plan. So when we're looking at the two different options of, once you have Medicare, you've got two ways to, I use the word backfill, or to be able to pay for that 20% that you are responsible for. So the option number one, if you keep Medicare in place, Part A and Part B, and then you also add a Medicare Supplement or a Medigap plan. And I've worked with a lot of physicians in the past, and a lot of physicians do prefer to go the supplement route. And the reasons are, number one is that you're not restricted to a list of network providers. you have the flexibility to see whoever you want, whenever you want. And the other part that's nice about a Medicare supplement is that you've got no state boundaries. You've got travel coverage, including foreign travel coverage. So you pay a premium up front for a Medicare supplement. And then when you do use your supplement at a doctor, a hospital, whatever medical services that you're needing, you simply show them your Medicare card, your supplement card, and you walk away without having to pay any copays or coinsurance. I do want to say that in the Medicare supplement world, you do need to pay, or you are responsible for paying the Medicare Part B deductible. And this year in 2021, we haven't gotten the 2022 numbers yet, but in 2021, that Medicare Part B deductible is $203. So it's a nominal cost for giving you so much flexibility on your coverage. And if in fact you're going to look at option one, keep Medicare Part A and B in place, enroll in a Medicare supplement plan, then you'll also want to enroll in what we call a standalone prescription drug plan. And that's simply prescription coverage through a private insurance company so that you then have access to your prescriptions and help to pay for the cost of them. You also are getting around some costs that would otherwise be on your watch. So in fact, if you want to look at the other option, option two, Medicare Advantage plans, they're also known as a Part C plan. And a Medicare Advantage plan, it technically, legally has to offer everything that Medicare Part A and Part B offers, but it also includes drug coverage and it has additional benefits like some of the hearing, vision, hearing aid, dental, vision, and hearing. Sometimes you get a few other benefits as well, but they all have to have Medicare Part A, Part B, and Part D included. So let's look at what a Part D plan, let's go into a Medicare supplement. So as I said before,
Kathy, we have a ton of questions, so I'm thinking you should just keep going, and then at the end I can dive back into some of these because they're pretty pointed and specific, and I want to interrupt what you're talking about, just so you know.
Okay. So I know we had 30 minutes on the clock. Are we okay with going over a little bit?
Yeah, I think we have plenty of time.
Okay, perfect. So a Medicare supplement plan, I'm just going to do a real quick review. So Medicare supplement or Medicare Medigap plan sits on top of original Medicare. So you have Part A and Part B and your supplement or Medigap, and you do pay a premium for the policy. You also are purchasing that policy through a private insurance company. So all of the supplement policies are standardized. The benefits that you get from any of the plans are the same, no matter what private insurance company that you go to, but there is a premium difference. So one of the things that you would, one of the counsels that you would receive, whether you were talking with myself here at Chapter or with Stephanie and her group, American Medical Association Insurance, we would be shopping for the plan that is in your best interest for benefits, but also keeping your costs down. Last but not least, you get a Medicare supplement plan. When you first sign up for Medicare Part B, you do have to have both components in place. So one of the very common questions that we receive, and maybe it's one of the questions that's in the trailer here, is if I have a pre-existing condition, can I be denied for Medicare supplement or Medigap plan? And the answer is it depends. So first and foremost, most states, now Connecticut and New York have different rules, but most of the other states, if in fact you're enrolling for a Medicare supplement plan within the first 6 months of Medicare Part B being in place, then you have what's called guaranteed issue. So you don't have to worry about being denied coverage. You're not worried about being charged an additional premium. On the application, all they're asking you for is your name, your address, your phone number, your Medicare number, and they're inviting you to the party to have coverage through that particular company. If in fact you wait past 6 months of your Medicare Part B being effective, then you do need to go through underwriting. And that, I think you probably understand what that means, but you do have to include all of your doctor's names, your prescriptions, your conditions, and you can be denied coverage. So most of the time when somebody is wanting to go with the Medicare Supplement coverage, they apply for that from the get-go. That just makes it the easiest. So in addition to a supplement plan, you would want to have a Medicare Part D plan, that drug coverage. So number one, Medicare Part D only deals with prescriptions. So it doesn't have any other benefit to it. You pay a monthly premium for it. The government also pays a portion of the premium. Plans are very affordable. And like I said earlier, technically it's not required that you sign up for a Part D plan. However, you get around any kind of penalty that might be imposed upon you if in fact you wait to enroll in a Medicare Part D. So if in fact you were to wait on a Part D plan, and I'm hoping that this is encouraging you even more to grab a Part D from the get-go, but if in fact you were to wait, the penalty goes like this. Every month that you wait or you delay enrolling in a Part D plan from the moment you're eligible, and that's when you have Medicare Part B, then you're going to pay a penalty, and this year it's 33 cents a month. So if you delay for a year or 2 years, that 33 cents a month times however many months you have delayed comes up to, and let's just pretend it's $20. That $20 isn't a one-time penalty. That $20 is then part of your monthly cost on top of your premium for the plan, and that penalty is a lifetime penalty, not just a one-time penalty. So it really is in your best interest to go ahead and get a Part D plan from the very beginning. You not only have coverage for your prescriptions, and if you don't take prescriptions, we get a very affordable Part D plan for you, but you've got a safety net just in case you are prescribed something throughout the year. So last but not least, how does it go when you are trying to select your very specific plan? So this is just for illustrative purposes, of course, but there are many, many plans in almost every county in the United States. For instance, you may have 137 different supplements offered in one given county. And talking to an expert will really be able to whittle down which of those plans is in your best benefits and financial best interests. Now, when we're talking about Medicare Advantage plans, I know we have 46 up here, but I've seen counties that have a lot more than 46 different plans. It's awfully nice to be able to talk to somebody who has the lay of the land and has the tools at their fingertips to be able to shop and find the plan that fits your lifestyle, your budget, your needs, your wants. And so we want to specifically look at who you are and what you are, the doctors you go to, the facilities you want to be able to access. So the things that we consider when you're choosing a plan, like I said, are the doctors that you want to go to. We also want to look at premium. So the costs that are included are the premiums, your out-of-pocket costs, whether it's copay or a coinsurance, and any expected premium changes in the future. Now, here at Chapter, we do have an algorithm in our quoting tool that we're able to, and it's not a crystal ball, but we can certainly help to predict what future costs may be for a supplement premium based on what they've been in the past. Now, when we're looking at choosing a prescription drug plan, we certainly would want to know, kind of get a snapshot of what your prescriptions look like, the name of your prescription, the dosage, the frequency, so that we can then shop the plan that's going to cover all of your prescription, keeping as much of your money in your pocket and allowing you to receive your benefits and your prescriptions at the pharmacy that you would like to receive them at. And last but not least, lifestyle and location. So we want to make sure that where you're living, where your permanent residence is where your insurance is based from. So that's technically going to be in your best interest. And then also if you travel, we want to make sure that you have coverage, whether you're traveling through the United States or if you're traveling abroad. So last but not least, it's super important that every single year, once you've been in the Medicare world, that we review your coverage each year, because there are many things that change from year to year. So the plans can change, the benefits can change, the premiums change, the co-pays, the networks change. But one thing that we don't have even listed here that's super important is your health could change. So your needs may be different from one year to another. So I think it's super important for you to be able to talk to a professional and understand what your options are this year versus next year, and make sure that we're always maximizing your Medicare benefits, that we're keeping your money in your pocket, but that you get every benefit that you are entitled to. So right now, we're just approaching the Medicare annual enrollment period. It's October 15th to December 7th, year in and year out. And that is the point in time of the year that you can have your plan reviewed and that you can switch. Now, if in fact you are reviewing your coverage during that period of time, please know that everybody does their work during that period of time, but that your plan would be effective the first of the following year, so the 1st of January. So there's never any cost for any advisor to do these reviews, do any of this shopping for you. By law, we are at your service and we're happy to do it. And I'm sure Stephanie would agree. It's wonderful when we can help you guys find a solution to that ever burning question, Medicare, what do I do with it? So with that, let's go ahead and take some questions and we will make sure everybody is walking away satisfied.
All right, let's see here. We have quite a bit. Let me just scroll on up here. Just give me a minute. I did go ahead and message everyone. If you have specific policy questions, you can email us at wecare@amainsure.com and we can help answer those questions. But if I miss one, I apologize. I'm going to try to go up in the order that I received them here. There's quite a few. Okay, let's see here. We had Dr. Michael Horowitz. He said, I'm over age 65. I had credible employer coverage for many years until I was laid off. My coverage stopped 9/30. I'm currently on COBRA. I recognize I need to enroll in Medicare within 8 months. And then in parentheses, secondary enrollment period. But I only have 63 days to enroll to avoid a drug plan penalty. At the same time, I've had regular HSA contributions as recently as September 17th, which could invoke a tax issue. So how do I balance these competing time restrictions? And then he said, thank you.
You're welcome. So as I heard you say, the last day of coverage was September 30th?
When I lost the question here. Yes, September 30th.
September 7th. So being the last HSA contribution was prior to September 30th, there's no tax issues there. You just simply cannot make any other contributions to the HSA plan after you have enrolled in Medicare. So that takes care of the HSA component of that question. Now, COBRA is not considered a credible coverage through here. So you do need to enroll in Medicare Part A and Part B so that you aren't penalized later for that period of time that you were on COBRA. Run into that issue a couple of times. Not a good scenario. So I would encourage you, and I'd be happy to email you the instructions, the cliff notes on how to enroll in Medicare Part A and Part B, but I would encourage you to enroll as quickly as possible so that you don't have any more lapse in coverage than is already part of this scenario.
Dr. Michael Schmidt asked, as you were talking about enrolling in Medicare, how long does it take for the coverage to actually begin?
Great question. So kind of funny, I was thinking as I finished answering the last question, I should have approached that timing issue at the same time. So here's two birds, one stone. So if I were to enroll today, if I were to put my application in today, typically speaking, it takes about 2 weeks for everything to be turned around within the Medicare system. And once you have your Medicare number, then you can be enrolled in a Medicare plan on a dime. It typically can be taken care of within 24 hours, and your policy can be effective the very next day. Now, you won't have your card in place, you won't have your policy number in hand, but you will be enrolled, and we will be able to get you that policy number and card in hand within about 2 weeks. The most important thing is to get that Medicare number ASAP, and then contact the professional, whether it's AMAI or us here at Chapter, so that somebody can help you get the appropriate plan in place, whether it's a supplement, a drug plan, or an advantage plan.
Question from, again, pronunciation, Dr. Dennis Dietrich. Please discuss limitation of which doctors you can see on Medicare Advantage plans, any limitations on drug coverage which require prior authorization.
Great question. So Medicare Advantage plans, they work exactly the same as traditional or commercial plans, your group plans. You either have an HMO or a PPO. And with an HMO, you have a list of providers. You need to see somebody on that list to be able to use your benefits. And a PPO on the flip side is in-network or out-of-network benefits. If in fact you go to a physician that is on the in-network list, then your cost will be less. If you go to a provider on the out-of-network arena, then you're going to pay a little bit more, but you do have coverage. The second part to that question was, Stephanie?
The second part of the question is
prescriptions.
Prescription drug coverage and which ones require prior authorization.
That's right, prior authorization. So depending on which Advantage plan with prescription coverage or a standalone prescription drug plan, they all have a little bit different formularies. So it's really determined by the exact plan that you're enrolled in. So that we could discuss that as we're looking at plans and seeing your particular prescriptions and being able to inform you as to whether that particular prescription has limitations on quantity or prior authorization. Also with a drug plan, I just want to mention that all of the plans have preferred pharmacies as well as standard pharmacies. And if you speak with one of us, we'll be able to let you know which pharmacies are preferred on which plan. They're all different. So if you're with company A, you may be going to pharmacy B, and if you're on company B's policy, you may be going to a different pharmacy to be able to maximize your benefits, to be able to pay the lowest copay. So preferred pharmacies are important.
Okay, it looks like Dr. Rockwell said it's not uncommon for Plan D to change coverage for the meds in parentheses that people chose the plan based on. Can we change Plan D then?
Yes, so I want to answer that with kind of a two-prong answer. Yes, during the annual enrollment period, you can change your Plan D, and we recommend highly to have all of your coverage reviewed, reconfirmed each year. So you can change Part D plans during the annual enrollment period and have a different plan in effect for January 1st of the following year. The second part to that is if in fact you're in a plan, let's say you took 3 prescriptions and you were enrolled in a plan based on those 3 prescriptions and coverage of, but 6 months down the road, your physician prescribes a different medicine to you and it's not on the formulary, then your physician simply requests, based on medical necessity, that that prescription be brought into your own personal formulary, and that prescription can now be covered, even though it's not on the general formulary.
Next question, Dr. Kim, I will turn 65 in March 2022. I currently have insurance through my employer, including for my younger husband and college-age daughter. What would you advise in order to get Medicare access for me and yet continue private insurance benefits for them?
That's a tricky one. So most group plans, please understand I'm saying most group plans will not allow the employee to go off of the medical coverage and maintain coverage for your dependents. There are some exceptions, so I would encourage you to talk with your HR department and see if in fact you can transition and your dependents, your wife, your husband and your child can stay on.
Dr. Dennis, is there not an option for a Medicare supplement that does not limit which doctors you can see?
A Medicare supplement doesn't limit your doctor choices. That's the flexibility and freedom that a Medicare supplement offers. So if in fact a physician or facility accepts Medicare, they will accept your supplement as well. And that differs from the Advantage Plan option, option number 2, where you do need to go to a physician and facility that is on the list in the network. So the flexibility of a supplement is that you get to choose wherever you want to go, whenever you want to go. You don't need pre-authorizations. You have no state borders. You, on a couple of the plans, you actually have foreign travel coverage.
We have Dr. Michael. How do you avoid getting retroactive Part A on enrollment to avoid conflict with recent HSA contributions?
I'm not sure I understand the question. Medicare Part A was enrolled in?
Yeah, so I'll read one more time. How do you avoid getting retroactive Part A on enrollment to avoid conflict with recent HSA contributions? And Dr. Michael, feel free to, to expound upon that, and I can go ahead and pass that to Kathy if we need to.
What I think is being asked is, he enrolled in Medicare Part A and continued to contribute to an HSA, and those two things conflict. So you can either back out your contributions to the HSA, or you can, I hate to say it, but call Social Security, be on hold for a while, and ask for your Medicare Part A to either be put on hold or to be terminated and to be re-enrolled at a future date. But that requires being on the phone with Social Security. You can't do that via email. It requires a phone call.
Okay, we've got, let's see, we have Dr. Frank here. I'm 66-year-old and working full-time. I enrolled in Part A during the 7-month initial enrollment last year when I turned 65. I stayed on my group policy. I'm considering retirement next summer after I turn 7. When can I enroll in Part B and D as well as Medigap coverage to avoid penalty? I plan to retire next July 2022.
So as I've mentioned through all of this conversation today, I think it's in your best interest to compare what your group plan is offering you, premium as well as benefits, as compared to what you can currently get in the Medicare world. So that would be my first layer answer, is take a look at it right now and see if it's in your interest to enroll at the moment. If not, then you said March is the retirement date, right?
It is, he says that he plans to retire July, so next July 2022.
Okay, July, so I'm doing my finger math. So July, if you want July coverage to start, I would enroll in Medicare in May, somewhere in the middle of May, because it typically takes 2.5 weeks for that enrollment to be issued. And then you're able to talk with an advisor and go ahead and have July 1st coverage through Medicare, and whether you're going the supplement and drug plan route or the Advantage Plan route, you'd be able to have option 1 or option 2 in place for July 1.
And then Kim, it looked like Dr. Kim earlier had a question. She followed up again. She had asked originally about herself with Medicare and private insurance for her family, just to give you a little backstory. Dr. Kim says, could I continue both Medicare for myself and also have the private insurance for my husband and daughter?
Yes, if you go the private insurance route and it's not the group plan route, yes, absolutely. So I'm not sure what state, and I don't need to know what state, but you would have to look at the marketplace to see what kinds of plans are available. And I highly encourage you to talk with an advisor to find out what are the private insurance options for husband and child.
Okay.
You know, further than that, if I could expand on that, if this were me, I would be creating a spreadsheet to take a look at exactly what the scenario looks like right this very moment for the group coverage, cost and benefits for all three, and then also compare if Dr. Kim goes into the Medicare world, do that same kind of comparison with Affordable Care Act plans so that you can see is everybody getting better coverage? Is the family on a whole getting better? So we look at the family.
Kathy, you're kind of going in and out a little bit, just your connection, just wanted to let you know, just a little bit kind of muffled. So I don't know if you want to repeat just one more time, just so to make sure everyone could hear it.
Okay, certainly. Is that any better? Maybe. Okay, good. So related to Dr. Kim and her question, I would at this point in time take a look at what your husband and your child are eligible for in the Affordable Care Act marketplace coverage. And I would spreadsheet it all myself. I would compare what you currently have for you as a family on your group plan, take a look at what options you have available to yourself in the Medicare world, and then also the options that are available for your family in the Affordable Care Act world, and then compare as a family what you currently have as opposed to Medicare for you and Affordable Care Act for your family. So I would compare on a whole, not just one part of the family or the other.
We reached the end of the questions that were submitted. If I missed any, go ahead and resubmit them to me really quick. I've tried to go through the list in order. I apologize if they weren't in order. But yes, now's the time to go ahead, and if you have any extra questions or thoughts that you'd like to submit, I'd be happy to route them through to Kathy. Okay, it looks like we have one more here from Dr. Frank. I travel in Texas and also many parts of the US as well as internationally. I can't imagine a Medicare Advantage plan to be a good choice for me. Does Medigap have benefits when traveling out of the USA?
Medigap does. There are a couple of the plans that you have foreign travel coverage. So yes, it sounds to me like a supplement would definitely be the route to go. When you're traveling, you want to make sure you have good access, easy access to care. So a supplement is the route to go. So I do want to make sure that if anybody has any residual questions, you also have my information. You can certainly email me at Kathy with a C, Kathy at askchapter.org. I'd be happy to answer any questions that you have. I'd be happy to elaborate on anything that we've spoken about here today. I'd also be happy to take any phone calls if you choose to call me. Is it okay if I go ahead and give out my number?
I believe so, yeah.
904-728-0212. I'd be happy to talk with you. So,
okay. We have a few more questions. Do you want me to go ahead and pose those for you? Okay, great. Yeah, you are the expert here. We're so happy to have you. Okay, so we handled this one. Dr. Raquel says again, if your group insurance is through employer with less than 20 employees, doesn't that affect what you need to do to re-enroll in Medicare?
Yes, it does. So not to re-enroll, but to enroll in the first time round. So if your employer has less than 20 employees on their health insurance plan, that's not considered a waivable reason to not enroll in Medicare. So as soon as you are turning 65, you're in your initial enrollment period, that 7-month window, we advise to go ahead and enroll in Medicare Part A and Part B. Medicare will become your primary payer, and your group plan is not required to offer you continued coverage. So you'll want to ask and see if they're going to offer continued coverage, but even if they do, they are a second payer. So Medicare makes sense at that point in time.
Can you go ahead and restate your phone number again? There's a few people just wanted to take it down. So
sure, it's 904-728-0212. And I'm in the Pacific Standard Time Zone, at least today. I travel too.
great. Okay, let's move on here. So Dr. Dennis says, are these statements true? It's like the following statements. Medigap policies allow more flexibility and are more expensive, whereas Medicare Advantage plans are less expensive and more restrictive.
Partially true, partially false. So supplements give you more flexibility as to supplement or Medigap. I want to make sure I'm using the term interchangeably. That offers you more flexibility as to where to get your services. And when he says more expensive, I really want to kind of dissect that for a quick second. So yes, you pay a premium for a supplement plan, and most Advantage plans or many Advantage plans have a $0 premium, and Medicare commercials are all over the television right now. So I know everybody's hearing $0 premium plan. Well, you do still have to pay your Medicare Part B premium. So even if you don't pay an additional premium for an Advantage plan, you do have co-pays and co-insurances that you're going to be paying as you receive services. And on that plan, you also have a maximum out-of-pocket number. So whether it's, and I'm just using numbers off the top of my head that are common, there may be a $5,900 max out-of-pocket or a $6,700 maximum out-of-pocket. So you have to look at that as your exposure on an Advantage plan, that you do need to budget for that. So if you were to compare your Advantage plan, maybe no premium, but needing to pay as you go, and that you could be paying up to, for instance, $6,700, versus on a supplement, yes, you pay a premium up front on a monthly basis, multiply that by 12, compare it to the maximum out-of-pocket on the Advantage plan, and you're going to see that oftentimes you're simply paying a premium ahead of time on the supplement, and you're paying the co-pays on the back end for the Advantage plan. Both plans end up being about the same cost over the lifetime of the policy. I certainly can't predict what your health would be, but I'm using an average here. So it ends up being, now, which is more important to you? The lifestyle of flexibility, paying a premium ahead of time, having the ease of going to the doctor, giving your supplement card, your Medicare card, and walking away without any other costs? Or are you looking at it being okay to have a network of physicians, which is perfectly acceptable? We've been doing that our entire lives. But then you also may receive some extra bells and whistles in hearing, dental, vision, and a few other benefits. But you do have the exposure of that maximum out of pocket on that particular plan. So I don't want to say one is more expensive, one is less expensive. They're different. You have upfront costs in a supplement and back-end costs in an Advantage plan. Does that make sense?
Okay, we have a couple. I went ahead and sent your number out to those that asked for it. That's good. And just as a blanket statement, I want to say, because a few of you have asked, after the webinar, we will be sending out a follow-up email that has the recording in it. So if you there's something you want to rewatch, or, and then contact Kathy, or you have a question, you'll be able to see it there. And that will come out within a week or so. Okay, we have a few more questions, Kathy.
Okay.
Is there an upcharge for Plan D coverage for those with higher income? And that's from Dr. Jeffrey.
Yes, there is. If in fact you're being charged an IRMA for your Part B coverage for Part B, Medicare Part B, you will also be charged. It's a much lower IRMA, but there is an IRMA on a Part D as well, as in drugs. I do want to just elaborate for a moment. Now, the IRMA chart that I'm happy to send that out. I can send it to you, Stephanie, and you can send it out, but one way or another, just know we'll get this chart out to you, and we'll do both the Part B chart as well as the Part D chart so you can see where you fall. But I do want to just give a couple minutes to devoted to this topic, that if in fact you're working right now and then you retire, say in 6 months, your income is going to change. So you want to take a look at that chart and see if in fact your new income, you can project what your income will be for next year, which will be lower than this past year because you wouldn't be pulling your paycheck. But if you can look on the chart and see if the new income would put you on a different level in the IRMA category, and maybe even take the IRMA away completely, then you would want to file what is called an income life-changing event. It's called an SSA 44 form through the Social Security Department, and have them adjust your Medicare Part B premium, which may also affect your Medicare Part D premium. And you do that for the first 2 years of being retired, because Medicare looks back 2 years at your income tax return to base your current Medicare Part B premium. Does that make sense?
Okay, we have another question from Dr. Raquel. Plan D, are donut hole and max out-of-pocket changing?
Yes. So every year those numbers change, and I'd be happy to send out a chart with all of the 2022 numbers. Can I send that to you, Stephanie?
Yep, you can send our way.
Okay.
Someone had asked, is there dental and vision coverage with Medigap? And also with Medigap, is international coverage limited in any way?
So international coverage is only on 2 of the different supplement plans, and there are numerous plans, but there's 2 particular ones that have foreign travel coverage. And it's unique in this supplement world to get some of those ancillary benefits, but they do exist. They're few and far between, but they do exist. If that's what you're looking for, I'd be happy to point you in the right direction. But it would be based on your state, your zip code. So I can't give out generic information because there's no such thing as generic in that particular topic.
Okay. Those are all of the questions that we got through. So if anyone has any others, I know we're getting close to time here. So if you have a few other questions for Kathy, go ahead and throw them out. And Kathy, I didn't know if you had anything else maybe you'd want to dive into before we all sign off.
Well, if more questions come through, that's great. I'm certainly happy to answer them. But I want to just stand here and say, knowledge is power. And I encourage anyone and everyone who's coming up on age 65 to really explore what are your options. It's in your best interest to know the best route for you and your family. Do take yourself into consideration, but again, as we talked in a couple of different personal situations, we do need to look at the whole family. So if in fact you would be emailing me or calling me, I will be looking at your entire family. But I think it's so important just to know what your options are. You've paid into the system for your entire working career. Take advantage of the money that you put into the Medicare bank, if you will, and utilize that to your best interest. So I really am honored that you had me come in and speak about Medicare. I love what I do. I love being an advocate for anybody in the Medicare world. I'm happy to answer questions for as long as you want to feed them to me. But thank you so much for including us in this moment of Medicare.